Hi, Dr. Gray. Thank you so much for joining me today to talk about leadership.
It's a pleasure to be here, Donnie. Thanks for having me.
You've got an important role in this community, and I'm just eager to learn how leaders kind of get to the place they're at and how they think about themselves in those roles. So we're just going to explore some topics.
Looking forward to the conversation.
Okay, great. So I want to start with the same thing I always ask people. I'm always curious, who in your life really shaped how you think about leadership, or you would look to and say, this person is really responsible for a big piece of who I am as a leader?
I think like most folks you've had on the show and during our most impressionable years, your parents.
Yeah.
And I would say the same thing for me. My mom and dad taught me early on that I had leadership potential. I didn't even really know what that meant, but they were preparing me all along the way to take on a leadership position in the future.
Okay.
And I'll give you just a prime example.
Great.
So I was in the 6th grade, had crazy teeth, by the way. And my mom said, hey, we're going to get braces for you. And because one day you're going to sit with leaders, you're going to be in front of people in an important role, and we don't want them to be distracted by your teeth. So I'm like, okay,
wow.
wait, what role are you talking about? And I'm just going to trust you in that.
Yeah.
And so they were very influential. And then the second person that I would say, and I'm not ashamed of my faith, would be Jesus Christ.
Yeah.
You know, we talk about different types of leadership, but he demonstrated servant leadership.
Right.
You know, he was anticipated for millennia. He was here for 33 years. He was in a leadership role for 3 years, and we're still talking about him.
Wow.
So I think he did some things right.
That's a great perspective. You know, I was thinking about your, I just have to say this, your braces story. My parents got me braces when we lived, and my dad was a minister, so we moved around a lot. I got the braces in one community where everybody in the 7th grade was wearing them.
Yeah.
Then we moved to another small town. And I show up on the first day of school, and girls came up to me and said, what are those ugly things on your teeth?
Yeah.
And my parents hadn't prepared me for that
right.
question.
They didn't make you the most popular person in school.
No, they didn't. Okay, so was that the first point at which you thought about yourself as a leader? So my question is, so at what point in your life did you start thinking, okay, mom and dad sort of talked to me about this, but you know, maybe I want to be a leader?
Yeah, I think it was determined by my environment. I was always nominated for leadership positions. I don't know that I understood why at that point. You know, team captain of my basketball team. I went to a boarding school, and I was the dorm assistant. Then I was a resident assistant in college.
Okay.
But as I grew and matured, I started to look back and I said, wow, leadership is really not about position at all. It's about serving.
Yeah.
And so as I tell my team of 7,000 people, everyone in this organization can lead because everyone can serve. And so I really started to focus on how I could be a leader in my sphere of influence, and it was agnostic of position.
Yeah. Well, you know, that's interesting about being an RA. Every year, I'm going to get you to come over here one year and talk to our RAs, if you'd be willing.
Okay.
I usually go and do a little part of their training, and I tell them I wouldn't be chancellor, I don't think, if I hadn't been an RA.
That's right.
It was my first time to officially get paid to help resolve conflicts.
That's right.
And at that time, they were things like, I don't like my roommate. They weren't like life and death issues.
Yeah.
But that's a beginning.
That's right.
Yeah. So transitioning to college, you were a first generation student, am I right?
That's right.
Okay, so how do you think that has shaped you as a leader, as having an interest in leadership, and even now as CEO of the hospital?
Yeah, it's taught me never to take the opportunities that I have for granted. As I said, my parents sacrificed a lot for me to be a first generation college student, and so I didn't want to fumble the ball, so to speak.
Yeah.
Number two, I have one younger brother, and so from a leadership perspective, I've always been a leader because I've, at least for 50 of my 53 years, I've had a younger brother that looked up to me. And I look at how my younger kids look to their older brothers and sisters, so now I really know what that meant to him. And I didn't want to mess it up.
Yeah.
And so I had that perspective early on, and so it made me probably walk a tighter line than I would have had I not had a younger brother, and had I not had parents that sacrificed so much for me to be in that position.
So did you carry with you in college, like, okay, was it a responsibility, a burden, I'm sort of embarrassed I'm a first gen student? Like, how did you think about it?
Responsibility, pride. You know, I started college in '90. My mom started college in '87.
Really?
And she finished in 2005. Wow. And I was finishing my general surgery residency at that time. So I saw her working full time, doing it nights and weekends, and what it took for her to get to that same place.
Yeah.
And so responsibility never really a burden, but there was pride in that. And I wanted to it motivated me to always give my best. One, to acknowledge what she and my dad had done, but number two, demonstrate the value of education, and especially in my community, a small community where not everyone went to college, 1,800 students, one high school, that kind of thing.
Well, I know for first-gen students here, it means a lot to know successful people who've been first-gen. So watching this will be important for them.
Yeah.
We encourage our faculty to share with students, hey, I was a first-generation student.
Yep.
There were still a lot of it. Randy Boyd was a first-generation student, very proud of it, and kind of defines. I wasn't, but I've come to really just see the opportunities for first-generation students that are uniquely theirs. So that's important. Okay, so let's just switch to your current role. You're the president and CEO of a major organization, UT Medical Center. If you could say, as the leader of all those people, what is your primary responsibility? Like, how do you think of, if there's one role that is the most important thing I do, what is that?
To encourage, to empower, and to equip.
Okay.
And so my son, I'll use my son. My son's 16 years old. He's a drum major. He's been a drum major for 2 years.
Oh.
Back to the crowd. And his job is to make himself invisible. If you're watching the drum major a lot, probably the band is not performing to the level that they should. Now again, the drum major has an intro and all that kind of stuff. I get that. But when the music's playing and your band is hitting their notes, they're focused on the melody, they focused on the music. And in order to get there, he's had to equip, empower, and resource every member of that band to play their part. Yeah. There's no one part that's more important than the other. The low brass is not more important than the woodwinds, and not more important than the percussion. But it's everyone working together for a common goal. Okay. And if you're in the marching band, that's to entertain or to win the competition. So my job is that. It's a drum major that equips and resources and encourages.
Yeah, I love thinking about it that way. Although you're certainly not invisible at the hospital, but people probably don't think about those things you have to do. My job, I feel here, is find the resources for you to do what you're trying to do as a leader.
That's right.
And people don't need to watch you find those resources.
That's
you
right.
just got to deliver them. That's kind of what you're talking about.
That's right.
All right. So I love UTMC. I love being part of the board, and I most especially am excited about the new strategic vision, which really talks about wanting to be an outstanding, top-ranked, I don't know what the word, I can't remember the language, academic medical center. Mm-hmm. So what does that mean to you? And I know you were driving a lot of that perception. What does that mean to you? Why is that important for this hospital?
So as you alluded to, we just finished a 3-year strategic plan for 26 through 28. We, changed our vision. It used to say transforming health.
Right.
But it changed to transforming lives as a top-tier academic health system. And so our job, yes, we are healthcare providers, but our responsibility to this community is more than just healthcare provision. It's helping everyone in our community, number one, have access to high-quality healthcare with a great experience, but number two, achieve their best health. And so we said transforming lives because we realized that while we have an important part to play, we're not responsible for the health of the community. We have to partner with key community organizations, with universities, with other key stakeholders to say, hey, together we're going to improve this health, because healthcare delivery is a fifth of it. Yeah. It's the food you eat, it's the community that you live in, it's the partnerships that you have, it's the housing stability that you have. We don't have expertise in all those areas. We don't control those things, but we can partner. We can leverage our brand, leverage our perspective in the community to say, hey, let's convene, let's come together and figure out how to transform the health and therefore transform lives in our community.
You know, I love that. And one of the things you do that I think is really, I think is meaningful at our board meetings, usually we have a luncheon session where you bring in somebody from the hospital to tell a story.
Yeah.
And what strikes, the story is always about a transformed life of a family, a patient. But what I also see there is the transformation of the team
Yeah.
who was delivering that. How do you think about that? Is that part of what you think about when you talk about transforming lives? I know the first transformation is the patient, the family, but I see that in the words they express, in their eyes.
That's great. I'm glad you brought that up. One of the reasons for moving it from health to lives is because we're also impacting our team members, as you said. 7,000 plus, impacting many, many families, with the sixth largest employer in the region. And there's a sense of pride, there's a sense of empowerment when you get a chance to make a difference in someone else's life. You talk about leadership, but that giving gives you serving, pouring out, using your expertise to change someone else's life, really just makes you want to do it all over again the next day. So we talk about how our team members, again, going back to the band example, everyone has a different role and responsibility, but no one individual is more or less important than the other.
Right.
And together we come together as this beautiful symphony to change our community.
As you were speaking, it made me think about a bit of a shock for me when I moved from, let's say I was a dean, I had 100 faculty, 50 staff, I knew everybody, and then I moved up to a university level position where I asked somebody once, could you give me a printout of all the people that report up to me? Printout was like that thick.
Yeah.
And I had a vision of, I'll get them all in a room and we'll have a town hall meeting. How do 7,000 people get to know Dr. Keith Gray? Have you ever thought about just how do you do that? Like if you were managing a surgery unit or a practice, they would all see you interact with you. So what are some of the things you do to try to help those people know Keith Gray?
Yeah, one, I pride myself on being transparent, being vulnerable, using mistakes that I've made just to be direct, and helping others not make the same mistakes. Number two, I listen. And so therefore, by listening, I know where the tension points, the hot spots are in our organization, and I go there and I'm intentional about spending time to understand more and how we can help them navigate those challenges. And lastly, I don't, it's easy, as you know, you get busy, you could be in your office all week and don't even realize you've been there, and you haven't seen anyone, you haven't gone outside of your duties, if you will.
Right.
But I am intentional about getting out. We call it a Gemba walk. It means to go see.
Okay.
Get out, go see, and part of that is being seen.
Yeah.
Be in people's space so that you understand what the challenges are. And for me, being a physician leader with a physician background, I understand, the challenges may be better than someone that doesn't have that background. So I leverage that.
Right. So, one of the things I also see you do is you're really out there in the community. United Way, this, that. And I remember during COVID, you and Dr. Shimeo were very visible faces. You were out in the community trying to figure out how to deliver health care to communities during COVID. So to what extent is that an intentional part of your leadership strategy, or is that just Keith Gray, like doing the right thing? How do you think about that?
Yeah, I think going back to our strategic plan, as we put that together, the question that we always came back to is, what are the problems to be solved?
Right.
And you can't identify those problems unless you're out. I mean, people can tell you things, but you got to go out and witness it. And one of my sayings is, once you see it, you can't unsee it.
Yeah.
And so when I go in the most disparate parts of our urban community, our rural community, I can't unsee that. As a practitioner, I'll dial back a decade.
Yeah.
I used to see people come into my office with the exact same diagnosis, but their outcomes were very, very different. Their ability to either tolerate treatment or understand the treatment options were very, very different. And so I started to look at where they were from, their educational background, the support system, and that made a difference in the prescription or the treatment that I prescribed for them, because they may not have had the resources to navigate one treatment or the other. I'm not saying treatments were inferior.
Right.
They were different.
Right.
But if I hadn't been out in the community, if I hadn't understood, we call them the social determinants of health, then I couldn't offer the best for my patients. So now I get to do that on a grand scale.
Right.
To know what problems there are to be solved and to work toward those solutions.
There are leadership scholars who would say leadership's the same way, that different people let's just take your leadership team. Different people are going to respond to their roles in different ways. And rather than think about one style of leadership, you're kind of customizing
That's
all the
right.
time. Do you find that, because that seems like that could carry over from the way you thought about your role as a physician to your role as a leader?
Yeah, we call it personalized medicine.
Yeah.
And people, when you say personalized medicine or precision medicine, people automatically jump to your genetic profile.
Right.
But it's really your whole being.
Yeah.
It's your genetic differences or mutations or whatever it is, but it's also your surroundings, your ability to travel to a remote location to get treatment. We take all that into consideration.
Right.
You'll hear I used to talk to my residents. I said, it's patient profiling, and profiling in our country has taken on a negative connotation.
Right.
But when patients walk in the door, I say, obviously I'll call them by their name, their surname, and I would say, where are you from? Who's here with you today? Or how did you get here?
Yeah.
Those three things tell me more than anything that I've studied, in the places that I've trained. When I ask them, where they're from, in my head I think in zip codes and census tracts, so I know the characteristics of that area. And then who's with you? If they have no support network, that tells me something about what their outcome may be
Right.
after surgery. How did you get here? You and I would say by car.
Yeah.
And some people may say by bus, or I took Ethra. That tells me a lot right in the beginning, those first 10 seconds. And I don't want to stereotype. I don't want to
Right.
exclude treatment
Right.
options for them, but it gets me in the frame of mind to ask more questions to understand exactly what they need
Right.
to get the best outcome.
Where did you learn that? That seems like so simple, but so missed oftentimes, and so brilliant.
Yeah, I think it's experience, but I'll go back to the going and seeing.
Yeah.
Once I visited different places,
Right.
and I didn't start out my career doing that. I'll just be honest,
Yeah.
but 5 or 6 or 7 years into my career, I just noticed that different people had different outcomes, and I wanted to understand
Yeah.
why.
Yeah.
And so I got out in the community, and to your point earlier, is it just me? No, I'm an introvert. I am an introvert of all introverts.
Really?
But my role and responsibility to the community is to go out and understand how to best help them.
Right. Okay, so let's switch gears a little bit. I want to talk about sort of your transition to this role.
Mm-hmm.
You followed someone who'd been there 25 years, successful by all accounts, totally different from you.
Yeah.
Business person, Joe Landsman, I think of him as he would have been my auditor 25 years
That's
ago.
right.
But he came in at a time in the hospital and provided tremendous leadership. Some people would say, don't ever follow someone who's been there for 25 years. How did you think about that, and how did that shape your transition? Now we have a physician, executive CEO, very different. How did you think about helping the organization transition to Dr. Keith Gray?
Yeah, so I'll start by saying I think now I know that the organization needed different things at different times. In 1999, the organization needed one thing. They needed a Joe Landsman to take the bull by the horns and to help them navigate a new beginning, if you will.
Yeah.
25 years later, I hope I'm the right person for that job. But I've been able to build on a really, really deep foundation that Joe helped establish. And so I'll add that Joe was my mentor. And so I think the transition, one, he mentored me for a decade before the transition ever happened. Number two, he prepared me well, and the board and the community, for the transition. And number three, I don't think the board would have ever chosen a person that was going to take an immediate right turn once the transition was complete. I am building and really increasing the slope of some of the things that Joe started. There's some new things that we want to do. My personality is different, like you said, but I don't think about them as different or antagonistic. They're complementary.
Right.
And I think I'm building on the things that he started and hopefully taking it, as in his words, he would say, I want you to take it from good to great.
Yeah.
And I'm figuring out what
Yeah.
that looks like.
So you used a word there that I get asked a lot, mentoring. Joe was your mentor for 10 years. Could you say more about that? Did that start by you thinking just to yourself, I could do that job someday. I wonder how you do that job. Or was that more Joe saying, hey, you could do my job someday.
Yeah.
I want to talk to you about that. People ask me, did you ever have a mentor? I never had a formal mentor, but there were people who shaped me. So could you talk a little bit about that?
I'll start by saying, I always tell students that I mentor, you should have a personal board of directors. You should have people that just put wind in your sails all the time. That's my mom. I can call my mom right now and she's going to say, I'm not surprised, you can do it, keep running.
Yeah.
And then you got to have people that don't call me Dr. Gray, that just tell me the truth.
Yeah.
I have a friend in Savannah, Georgia that does that. And then my wife, understands it all. She's a physician, so she's on my board of directors. And so you always have to have that. But one of the people that was on my board of directors probably 15 years ago, he said, Keith, you could be running this place one day. Had no idea what he meant by that.
Yeah.
And so that turned into, I was getting an MBA at your Haslam College of Business.
Awesome.
And so I said, wow, I really think I would like to do this in the future, would like to
Right.
be in administrative medicine.
Yeah.
And so I left here that day of class. I went over to talk to Joe. I said, Joe, I'm interested in this. I said, what does my future look like? He laid out 3 options. The auditor came out of it. He laid out 3 options.
Yeah.
And he said, we looked at all 3, and he said, I think this is your best fit. You're not ready, but I'll help you get there. He's very direct.
Yeah. He was.
And I wasn't discouraged by that. We met
Yeah.
every quarter, and he put balance sheets in front of me, and so on and so
Right.
forth. But he just incremental responsibility. He helped me solve problems. He said, go bring me a solution, and I'll help you implement. He never solved it for me. Those types of things. So I gained courage. He gained confidence in me.
Yeah.
And it was a beautiful marriage, if you will.
I hope people, I'm so glad you said that, because I want people to hear just what you said, that sometimes people think, well, I'm doing a good job. If it's meant to be, it'll come to me.
No.
And that is just really not accurate. And you stepping out there in a way saying, I think I might want to do this. Can you help me? Can you talk to me about it? That was initiative on your part. So
Yeah.
I hope the audience listening to this picks up on that, because that's
Yeah.
really important.
That's right. And for me, again, I'll go back to the faith. It's a faith walk. I mean,
Yeah.
I believe God is going to be the accelerator, the catalyst, but I've got to take some steps.
Yeah. Yeah.
I've got to take some steps.
Yeah.
And so I was intentional about that, but I was often also open to, God, whatever you have for me is what I want to be doing, because that's where I'm going to find joy, and that's where I'm going to be most effective.
Let me ask you this, just a side trail. When I stepped forward and became a leader in academia, there were people, faculty, colleagues, who said to me, what are you doing? And I felt a bit of like, oh, she's given up. She's now one of them. Did you feel any of that from your physician colleagues as they saw you kind of starting to move in that direction?
I felt some from them, and I thought inside that I probably was afraid that I would experience more than I actually did. Some people refer to you as have transitioned to the dark side, or now you're a suit.
Yeah, exactly.
Those types of things. But I knew the type of community and statewide impact that I wanted to have.
Yeah.
I was comfortable and confident in that, and I knew I just needed to gain the skills. And again, I wasn't turning my back on them.
Right.
My job was now to make your job, make you be more effective in your
Right.
role, and I understand your perspective.
Yeah.
And so therefore we can maybe partner even better than before, because I get it.
Yeah.
I get what it's like to sit in front of a patient that you don't have resources to help.
Yeah. So I want to ask you a little bit about partnerships. Both your organization and ours are really aggressively looking at partnership. In fact, we just won a national award from universities for our research and partnering. I just had to get that in. You have chosen to partner with, you have a lot of partnerships, but the ones that really matter to me are wanting to partner with UT Knoxville, with the UT system, with UT Health Science Center that's in conjunction with us, with the lab. All of that is a space we're all moving in. What made that powerful to you? Why did you choose us? How do you think about partnerships, and how did you end up saying, you know what, there's a lot we could do with the university right across the river?
Again, I asked myself, what are the problems out there to be solved? Does UT Medical Center have a role in that? Can we do it all on our own, or do we need to bring in a strategic partner to help us solve that, take that problem solving to completion, or do it at its best?
Yeah.
And so, for example, one of the partnerships we have is related to nursing.
Yes.
There's a nursing shortage crisis. It has been for a long time. It's not new. I think it became more obvious post-COVID,
Right.
but it's been there for a long, long time.
Yeah.
Part of our mission is education, training the next generation. We can't recruit our way out of the deficit that we have in this community, so we've got to grow our own.
Yeah.
You guys are among the nation's best in training nurses, bachelor prepared nurses, and you're right across the river. That makes sense. Philosophically, we're aligned, we're an affiliate of the UT system. Why try to do it on our own?
Right.
And number two, we want to partner with people that have expertise in that area. We have the clinical training ground, you have the expertise in the education. So again, it made sense from a research standpoint. That's the third part of our mission, discovery. We want to do research that is meaningful to the transformation of health for people in our community.
Yeah.
You guys want to be a top research,
That's
a top
right.
25 research institution in the country.
Right.
We both have aligned goals.
That's right.
But you win, it's a triple win. You win, I win, but more importantly, the community wins
Yeah.
by our partnership. I look for synergy.
Right.
Is really when I consider partnership. Is there synergy there?
Right.
Then it makes sense.
Well, you know, I think of the day that we cut the ribbon on this beautiful building,
Yeah.
and y'all were there, and we also announced your naming gift.
Right.
And so just being here, you being here today is so symbolic.
Absolutely.
That was such a emotion. I've done a lot of ribbon cuttings and groundbreakings. That one was different. And I think for me, what made it different was you all stepping forward saying, we want to put our name on this building because this partnership means so much to us and we want it to in the future. But as you looked at the people that were in attendance that day, so many of our legislators were there,
Yeah.
so many of city officials. It was like one of the most joyful days. So I thank you
Oh, you're
again
welcome.
for stepping forward.
And I
like
think
that.
it was symbolic of possibility.
I do too.
Yes, what we are doing, what we have accomplished, but man, what we can do,
Yeah.
it's limitless.
That's
It's
right.
absolutely
That's
limitless.
right. All right, so I want to talk a little bit about some of the treachery of being in your role, my role. One of them is decision making. And both of us are operating in environments that are just changing like this. And some of us might have been trained that, boy, analytical approaches to decision making, be very deliberative, gather all the data you can, which we still think is important. Yet we're moving so fast. We're moving in a world that's fast. How do you handle that in terms of being confident in the decisions you're making in a fast-moving world?
You know, I want to go back to mentorship. One of my mentors is a surgeon leader, now a CEO at another organization. And he said he thinks surgeons are uniquely equipped to be leaders in a fast-paced environment because we're used to that in the operating room. You know,
Interesting
most
point.
of the time, we want our operations to be boring. Let me just
Right.
say that. You don't want
Yeah.
excitement in the operating room. But occasionally there is, and you've got to make quick decisions. You've got to rely on your team, and sometimes you make decisions without all the information. And so that translates very, very well into leading an organization. It's a bigger operating room, if you will.
Right.
But I've got people in there with different skill sets that I have to rely upon to do their job. So the first point to answer your question is, I can't do it all. I have to really rely on my team.
Right.
And so you taught me when I first took this role, you said it took me X number of years to develop my team.
Right.
And so I've been really intentional about trying to put good people around me with
Right.
expertise that I can rely on so that when they bring me information, I trust it because I trust them and I trust their training.
Right.
And so, good team, I always ask again, are we solving the right problem? And then how are we equipped to do so? Do we need to go out and get a strategic partner? And the last thing I'll say is, has the problem been solved before elsewhere?
I love that.
Hopefully I'm humble enough that I don't need to reinvent the
Yeah.
wheel. I develop relationships across the state through the Tennessee Hospital Association
Yeah.
so that I can pick up the phone and call Michael Ugwecki in Memphis or Jason Little or Buffy Key at Cumberland
Yeah.
and say, have you guys encountered this before? If so, what did you do?
That's great.
You know, one of your deans and I were talking about this before we went on camera about quality, providing quality care. If we're having challenges in an area, I'm going to go and find out who's
Right.
solved that problem and pick up the phone and then pair my team with them and share lessons learned. That's going to keep us from, making the same mistakes, but it's going to accelerate our ability to find a solution.
You know what I think is exceptional about that is that you're taking not a competitive approach. The competitor in us is like, I don't want to admit I have any issues I don't know how to deal with.
That's right.
And you just said earlier, make yourself vulnerable. In a way, you're doing that. One of the first things I always say is, what are our peers doing? What are our aspirants doing?
Yeah.
We don't need to reinvent the wheel.
Yeah.
Well, I'm a great plagiarizer of other people's ideas, if they've solved it in a way. So that's really interesting hearing it, but I think it's unique. I would not assume that everyone else is like that. There are a lot of sharp elbows, don't you think, in this business?
I agree, but Donnie, I'll say, we're not selling widgets for market share.
Right.
We're saving lives.
Yeah.
And
Okay.
if someone else can help me save a life, I'm all about it. And if
Yeah.
I can help someone else do the same, I am all about that.
Right.
Even within the same market, I'll just say that out loud. We have strategic partnerships right here in our own market with our, quote, competitors,
Right.
because it's the right thing to do.
So a couple more questions. I want to talk to you a little bit about prioritizing. I find that challenging, and some of my staff, I'm sure, would say, we're doing everything all at once at the same time.
Yeah.
How do you focus on the most important thing to do? How do you set priorities and then adjust, keep them? How do you think about that part of your job? Because I think people look to the leader, like, what is the priority here?
Yeah, one of the, again, most influential people in my life said, you can't have too many things. He compared your responsibilities to a plate. He said, eventually your plate gets full. And if you're going to add something, you got to take something off. So my point is, you can't push an endless number of initiatives along in parallel. Mm-hmm. You have to decide how many you're going to do. And number two, I don't tackle anything or engage in anything or advocate for anything that's not on our strategic plan.
Okay.
If it's not a part of those 5 key strategic objectives that we've shared with the board, we shouldn't be working on it.
Yeah.
And then obviously you've got more than one initiative in each bucket. But then our team, our job is to prioritize and always go back to that. When good things come, hey, is it more important than this? If so, that's going to move down or that's going to move off the list, so on and so. So it's a structured way, but the job is that you're going to move 4 or 5 things along at one time. Yeah. You have to, because speed matters.
Yeah,
Speed matters from a competitive advantage. I'll just get that out of the way.
Right.
But it matters to the health of the community.
Yeah.
Sometimes we don't want to be, we don't want to be beta sites necessarily in every situation, AI, for example, but we want to be early adopters in areas where it makes sense and where it makes a difference for my team and where it makes a difference for the community.
That's a hard thing sometimes for organizations where tradition is so much part of who they are. Universities are that way. We want to study things to death. We're really good at talking about problems. It's harder to jump in there and say, okay, this is the solution we're going to grab. We've looked at this, and here's where we go.
One of the things that we've adopted, and Dr. Shamia has led this on our campus, is an initiative called Operational Excellence. And to make a long story short, it's daily management. It's allowing the frontline team members, giving them the responsibility, equipping them, and the courage to solve problems, and the courage to be wrong sometimes. Yeah. But like you said, we've got to pilot it, and then by the time the pilot's done, you can't even remember what problem you were solving.
Yeah.
And so if they have a solution, they're in the trenches every day, let's try it.
Right.
As long as it doesn't put patients and team members at risk, let's try it. And if it fails, you know what? We'll huddle and we will try something else tomorrow.
You've used the word courage several times, which I love. Mm-hmm. I do think that real, authentic leadership involves courage every single day.
Absolutely.
So that's why we kind of need each other in this business.
That's right.
Other people struggling. I got one last question for you.
Great.
I hope there are a lot of young people watching this who are thinking, well, maybe I could be a leader in healthcare someday. What advice would you have for them?
I would, first of all, let them know that healthcare is not just being a clinician. You don't have to be a nurse or a physician to be in healthcare.
Okay.
We run a city within a city. Again, we have 7,000 plus people on our campus. We impact a lot of families. And so, to your point, we need auditors. We need accountants.
Yeah.
We need environmental services workers. We need ground maintenance crews. So we need whatever a city would need, that's what we need to do what we do. So you can be in healthcare and not be a provider. Yeah. Number 2, a leader in healthcare, as I said before, start by serving, start by solving problems. My leadership journey at UT Medical Center began 3 months after I showed up, because I marched into Joe's office and I said, I've got a problem. And again, he said, what is your proposed solution? Bring it back to me and I will help you implement. So I had no ambition of being in a CEO position one day, 20 years later. I just wanted to solve the problem that's in front of me. So the advice I would give is look around you, and you may be waiting for someone else to solve a problem, but you may be the one you've been waiting for. So you've got to jump in and you learn how to solve bigger and bigger problems. And pretty soon, you will be recognized as a leader. There's a leadership void in this country.
Oh, yeah.
And so if you can solve problems, if you can do it in a collaborative fashion, then you're going to be sought after. The leadership will take care of itself.
What I love about what you just said there is that you stepped forward and said, I have a problem. Mm-hmm. That was leadership.
Yeah.
Oftentimes we think the leader's the one that goes, here's the solution to all your problems.
Right.
So good for you. And I think that will be encouraging to young people and anyone listening to this. Thank you very much for doing this today.
Thank you for the opportunity.
Appreciate everything you do.
Thank you.